everyone, it's Elise Kleckner. I am doing our end of semester reflections video. So the first question is, what surprised you from the materials this week? What did not surprise you? To be quite honest, nothing really surprised me. This is my second attempt at taking this class, so I've read all of this material before, as well as I've done a lot of previous studies on this material because of the past that I have with mental health issues, not only myself, but my son, my mother, and also my dad, who unfortunately took his own life when I was 6. So I have a very, very deep-seated um, obsession with mental health issues. Identify 3 things you learned about the mental health disorders. So the first, it can affect anybody at any time, does not discriminate. Mental health disorders look different on everyone. No one experiences mental health issues the same way as somebody else. And then also, depression is more prevalent in women than in men. This one actually, I guess, surprised me a little bit. Um, but not really because women tend to internalize a lot of things because they feel like they're being a burden upon other people. That's honestly how I feel sometimes. Next is identify 3 things you learned about substance abuse disorders. Substance abuse disorder is a mental health problem. Many think that addiction um, can be fought by just saying, okay, I'm going to stop. But it's not. There is a chemical imbalance that is going on in the patient's head that is making them more prone to having this disorder. Like I said just a second ago, some people are more prone to addiction than others. And then also, the most common abused drugs are tobacco and alcohol. And then finally, the last question, discuss how you will be able to implement what you have learned into your future practice. So my future practice is women's health nurse practitioner. And I think having knowledge about mental health issues is very, very important, especially since, in women's health, we come across a lot of women who are pregnant. And it's not uncommon for pregnant women to be addicted to drugs and or alcohol. So learning about mental health issues and being able to implement that into my practice, is kind of also being culturally sensitive because this is um, a culture that affects a lot of people. So having knowledge of this will help me be able to treat my patients more effectively. So that is all that I have. Um, I unfortunately can't say I enjoyed taking this class. Um, I really was kind of bummed about having to take this over again. But I did learn more this time than I did the first time. And I wish everybody the most of luck and hope everybody passes. All right, thank you.